In our health alert tonight, we now know donated blood from a Detroit area resident has tested positive for the mosquito-borne West Nile virus.
The Oakland County Health Department says it was notified of the positive test by state health officials, and it's the first blood donation in 2019 that's tested positive for the virus in Oakland County.
West Nile virus is primarily transmitted to humans through the bites of infected mosquitoes. And mosquitoes are infected with that virus by biting infected birds.
But if you knew you were sick, you wouldn't be giving blood. So why weren't these people showing some sort of sign of symptoms or anything like that, Doc?
So, Alan, you may think that you'd have symptoms, but most folks who get infected actually don't feel sick at all. In fact, it's only about 1 in 5 people that really develop a fever, get other symptoms like body aches, vomiting, joint pains, and diarrhea. So you can easily have the West Nile virus and not even know it, which is why it's really great that the American Red Cross tests blood donations for this along with many other infectious diseases. It's to help those who need blood that's safe.
Well, we say that because West Nile can be potentially serious disease and people can die from it, right, Dr. Nandi?
Absolutely, Glenda. Okay. In fact, last year here in Michigan, 104 people were sickened and actually 9 folks died. So while many people who get the virus recover, but about 1 in 150 will actually develop a serious illness that affects the central nervous system. And you have signs like encephalitis or meningitis. Unfortunately, about 1 in 10 will actually die. Although anyone at any age can develop a serious illness, those most at risk are people who are age 60 or older, plus anyone who has cancer, hypertension, diabetes, or kidney disease, much more vulnerable.
You know, doctor, when you hear about these statistics and these numbers, is there any treatment for West Nile? I'm sure a lot of people are scared about it.
Absolutely. Unfortunately, Alan, there are no treatments or vaccines available. So it's really important to protect yourself against mosquito bites until the cooler temperatures arrive, and then we're consistently below 50 degrees. Since we still have a ways to go before that happens, please use the EPA-registered insect repellents when you're outside. Wear protective clothing like long-sleeve tops and pants, and make sure your doors and windows are screened if you have them open. And please empty any standing water in things like flower pots, bird baths, and gutters. You know, really important, if we can take the preventative measures to prevent the mosquito bites, I think we'll be okay.
Yeah, it's scary stuff, Doc. Thank you for the
My
information.
pleasure.
If you have a question or health concern for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter. We'll get it right to him.
And don't forget to tune in this Sunday at 1 p.m. for an all-new Dr. Nandi show. This week, he's talking about the best foods for reducing stress and the transformation impact of meditation. That's September 8th at 1 p.m.